The spread of COVID-19 is causing very real concerns in Brampton, Ontario. This comes as parts of the city carry a test positivity rate double that of the United States.
Brampton makes up some of the highest percentages of essential workers, factory workers, people that work in industrial settings, essential workers in transportation, logistics, food processing.
The Brampton mayor there says that residents are putting their health on the line to take care of the rest of Ontario. Parts of the city are seeing a test positivity rate of 19%. Peel region as a whole sits closer to 9%. Joining me now with more on this is Brampton East MPP Gurratan Singh. Good morning. So glad you could be with us.
Thank you so much, Marcia, and thank you so much for bringing attention to this really important issue.
Yeah, it's really important, and we've got to have this conversation and be really open about what's going on there. What did you make of the mayor's comments and the fact that the test positivity rate is so high?
Well, if we look at Brampton, and the mayor, described this accurately, we're a city of essential workers. We're a city of folks who work in factories, folks who work in the logistics, they work in trucking, they work in the industries that help move our economy, and they don't have the privilege from working from home. And so when they go to work every day, they're at higher risk of exposure to COVID-19. If you couple this with the fact that Brampton is suffering a healthcare crisis, our city council declared a healthcare crisis before COVID-19. And now this COVID-19 issue has really exacerbated the situation. We're not getting the support we need from the Conservative government, and it's exacerbating and making the situation worse in Brampton. And that's why we're seeing, this virus going really out of control right now in Brampton.
And I'm not sure if you saw it, but Dr. Zain Chagla and Dr. Suman Chakrabarti wrote that really thoughtful piece in the Toronto Star a few days ago, talking about the importance of acknowledging what is going on in Brampton. And they outline a whole bunch of factors as to why the virus is running rampant here. There are multi-generational homes. There are new Canadians who don't want to get tested for fear if they are positive, they won't be able to go to work and make an income. There's a whole notion even around hospitality that if you go and visit someone, you need to feed them, and that leads to conversation, and that can go on and on. So, Gurratan, what do you think needs to be done to get the message out to the community? Is there a breakdown there in communication so that people can understand the severity of this coronavirus?
Well, it's about what the conversation and the narrative is right now. And we need to make sure it's very important that folks are doing everything they can to control the spread of COVID-19 and making sure that we are not doing non-essential travel over at least, listen to public health officials who are saying stay at home and don't do essential travel for at least the next 4 weeks. We need to listen to those public health officials. But what's wrong, what's happening with the narrative right now, it's not looking at the socioeconomic issues, not looking at the fact that Brampton is underfunded per dollar per capita for our healthcare system. We have one hospital for over 600,000 people. We are a growing, dynamic community, and we are a city full of essential workers. And that's the part of the narrative that's not being talked about enough right now. We're not talking about the fact that Brampton is disadvantaged, the fact that our hospital is so overcrowded that patients are being transferred outside of Brampton. And these are issues that have been happening for years because of underfunding from the current Conservative government and past Liberal governments. So when that part of the conversation is not included in the discourse around Brampton, then it's not going to actually look at the root issues of why COVID-19 is running so rampant in our community.
Okay, I hear you, but I also have to ask you about these large events that are taking place, like weddings. If you can't go to the temple, people are meeting elsewhere. There's celebrations going on. Do you not see that as also being part of the problem?
People's personal actions are 100% something that creates spread and something that we need to look at. But what the kind of angle that I'm trying to provide right now is that we're seeing a lot of focus on that, and that's important. People need to be responsible and make sure they're not increasing the spread of COVID-19. But what we're not seeing is the fact that when we talk to Dr. Lawrence Lowe, the medical officer here in Peel, he's saying that the largest areas of spread are happening in workplaces. They're happening in places because when folks are struggling to make ends meet and they have to pay their bills and they go to a workplace that's not following COVID-19 guidelines, then they're going to be at risk and they're going to go home and spread that sickness. That's a part of the conversation that's not happening right now. And that's what we really need to look at, because we can fix that if the Conservative government will provide Brampton and Bramptonians the funding we need for more investigations into workplaces, more testing. We were severely lacking. We only had 2 testing centers up until very recently, and now we have more pop-up centers, but it's far too little given the current circumstances in Brampton. This is a part of the conversation that's not happening, and that's what we're trying to bring attention to. We can beat this, but the Conservative government needs to provide more funding to Brampton and Bramptonians to fight the COVID-19 pandemic.
Does it concern you that the community might feel like they are being blamed for spreading COVID-19, that there could be consequences to singling out a city like Brampton?
Well, when you single out Brampton, think about who you're singling out. You're singling out a city full of essential workers who work day and night, putting themselves at risk to move our economy so others can work from home. We're singling out a community that has a healthcare crisis declared before COVID-19. And we're singling out one of the most racially diverse and dynamic communities in the country. So when you single out Brampton and you just blame Bramptonians for the spread of COVID-19, and you don't have that part of the conversation that's looking at the systemic inequities, quite frankly, that are holding our city back, then yes, it does feel like Bramptonians are being unfairly blamed for the spread of COVID-19, because it's not looking at the fact that we were set up to fail. When Brampton is not given support to build another hospital, or Brampton is not given the support for testing and other areas that we can prevent COVID-19 by this Conservative government, then that's going to really make it harder to control COVID-19, irrespective of how how much people personally are doing their best.
Thank you so much for speaking with us this morning, Gurratan. Gurratan Singh is the MPP for Brampton East. Hope to talk to you again. All the best to you.
Thank you so much. I really appreciate you bringing attention to this really important issue. We all need to do everything we can to fight COVID-19.
You got it.